Care and handling of contaminated endoscopy scopes. When pre-cleaning endoscopy scopes, wear a gown, gloves, mask, and eye protection, as there are risks of splashing. Pre-cleaning is performed using the manufacturer's instructions for use at the point of use immediately after device removal from the patient. To prepare for pre-cleaning, using the Zutron Fuji 700 kit, add 1,000 milliliters of water to the bowl and squeeze the sponge 5 to 7 times to ensure all enzymatic cleaner is added. When using the Boston Scientific Koala Pre-Cleaning Kit, submerge the enzymatic sponge into a bowl filled with 300 milliliters of water while squeezing the sponge at least 3 times to release the enzymatic detergent. Fill a 30 milliliter syringe with enzymatic fluid from the bowl and set aside. Using the enzymatic soaked sponge, remove any debris through starting at the top of the scope and wiping downward towards the tip. Turn off the CO2, remove the air, water button, and insert the cleaning card. Turning the air to high, press the card button for 30 seconds while the distal end or the tip of the scope is in the enzymatic cleaner. Remove the distal end to ensure water is expelled for approximately 10 seconds. Then turn off the pump and immerse the distal end of the scope into the enzymatic cleaner again, this time pressing and holding the suction button for 10 seconds. Then remove to clear the water, repeating this process 3 times. Flush the water jet channel with 30 milliliters of enzymatic cleaner. Follow this step by injecting 30 milliliters of air. Detach the suction tubing and the water irrigation line. Next, turn off the light source and push the End Exam button before removing the scope from the processor. Discard all disposable buttons, including the backflow adapter. Prepare the scope for transportation by gently placing it and any reusable accessories into the transportation tray, then documenting the completion of pre-cleaning and CenterTrack and applying the protective cap or tip protector to the end of the scope. Remember, the maximum tray load is 1 device. Apply the red plastic film, labeling it with date, time, and initials, and secure the tray lid. Promptly transport the scope to HLD using a cart. For hand transport, carry the tray in front of the body and parallel with the floor to prevent device damage during transport.